My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What? Our 21st episode. Thank you to my over 50,000 listeners. Thank you so much for your support, but go to YouTube and follow me. I'd appreciate some followers and some watchers, but I do appreciate my listeners. Today we're going to talk about a couple things, but before we start, some fun facts or fast facts. And I talked about common drug side effects last week, and I wanted to continue that. And thank you for some of our listeners' questions. One of them was acetaminophen, good old Tylenol brand name. What are its side effects, and are they worse or better than NSAIDs, non-steroidal anti-inflammatory drugs such as ibuprofen, Motrin, same thing, naproxen, those kind of things? Well, first of all, acetaminophen does not have an anti-inflammatory action. It's good for fever, it's good for pain, but it's not good for inflammation. And it has been found, if you use it long-term on a regular basis, to have significant liver effects. So you need to be careful. As always, talk to your healthcare provider, see what they recommend. But it's not something you want to take long-term. Speaking of that, GERDs, acid reflux, heartburn, it's all when you get that terrible burning sensation after eating or when laying down after eating in your upper chest and stomach, not to be confused with a cardiac event, which sometimes it is, but that you get on a regular basis. What's the major cause of GERDs? Only 5% of the population has a problem with production of stomach acids. So 95% of it usually is obesity, or especially belly fat, which pushes up on the stomach and creates the flap of your esophagus, your sphincter, to push open and leak the wrong way. Stomach acid was never meant to be in the esophagus, and you have to be careful long term. That can result in changes in the cells in the esophagus. So you don't want Barrett's esophagus or have a cancer of your esophagus. That's not what you're aiming for, so you need to treat GERDs. First thing I'd suggest, if you just lose 10 or 15 pounds, sometimes you see a miraculous difference. Be off of all medication. If you're going to take medication, talk to your healthcare provider. Change your diet. A lot of spicy foods, a lot of high-fat foods will definitely cause issues with GERDs. Reduce those is helpful. But if you're going to take medication temporarily, like Prilosec or Nexium or Prevacid, these are all proton pump inhibitors, they call them. So they actually reduce the formation of acid so that you don't have to worry about it being as strong when it leaks past that sphincter. So what you find is if you take those for a short period of time, usually prescribed by your doctor, or he tells you to take the over-the-counter or lower dose versions, that can help a lot, but that's a temporary measure. If you take those long terms, they have a lot of different bad effects. The most serious one being they can really cause bone issues, such as fractures, and they can also cause kidney issues, really cause some problems with your kidneys. You do not want to continually take those on a long-term basis unless you're a rare case and your healthcare provider tells you that that's what you need to do, your primary healthcare provider. So if you've been on them and just randomly taking them all the time so you can eat whatever you want, drink your beer and eat your pizza and eat your jalapenos and dip, you need to look into that a little more. It's not a cure-all. It's meant to be a temporary relief of symptoms until you get to the root problem, except for that rare less than 5% of people. And with that, we'll go to one that I think especially women should listen to. We talked about hormone replacement therapy, and for men it's a little different situation. I never recommend that unless you talk to your healthcare provider. There's a lot of issues with that. Testosterone replacement can cause a lot of issues, affecting your prostate, affecting your increasing your chances significantly for cardiac events such as heart attack or stroke. It can affect your blood pressure. It's really not a good idea unless there's some medical reason to do that and your healthcare provider tells you to take testosterone. But for women, different story. Whether you've had a hysterectomy or entered early menopause or you enter natural menopause, then hormone replacement can be a godsend, because the symptoms of all of a sudden lowered estrogen, even in perimenopause, can be really difficult, from thermoregulation to mood swings to skin issues, all kind of problems, itching, just, it's a real problem. It can make your life miserable. It can lead you to depression and weight gain. So what you need to do is carefully consider it. Talk to your healthcare provider, especially to your OB/GYN, as well as your primary care physician. And if you look at it, the major risk factors, side effects of estrogen replacement therapy or hormone replacement and progesterone therapy is blood clots. If you have a history in your family, you need to be careful. You need to discuss that carefully with your healthcare provider. And breast cancer. And again, if you don't have a big history of either one of those, it's probably not an issue you have to worry about too much. But again, I would take the advice of my primary care provider and my specialist as an OB/GYN. So look at those carefully, talk to them. Don't be just afraid and throw them out as, oh my God. It's not the same hormone therapy your mother had or your grandmother. Today, if you look at the dermal patches like estradiol, which is a synthetic estrogen, those once-a-week patches, wonderful. Don't go through the first pass in the liver. Much more smoothed out dose at a much lower level that can really be beneficial. If you have an intact uterus, you haven't had a hysterectomy, then you will also probably have a daily pill of progesterone. And that seems to be the safest, most effective treatment. So again, if you've got breast cancer, not concerns, but history, as well as blood clot histories or blood clotting issues in your family history, you need to talk to your OB/GYN and your primary health care provider to see if that's right for you. Many women say, no, I'd never do hormone replacement until they get into perimenopause or menopause, and then they're much more amenable. So you have to decide what the risk benefit is with every drug you take. The benefits are, there's a lot of them. Not only that you'll reduce those symptoms, but estrogen has a really good function in keeping your skin better hydrated, looking better, the elasticity better, looking younger. And I'm not saying that's the reason to take them, but it's a wonderful benefit. It reduces the amount of hair loss you have during menopause and perimenopause. It can help with the menopause middle, where you tend to gain not necessarily weight, but water and some redistribution of fat into your middle. Not something any woman wants to hear, or man usually. So you want to be careful about the estrogen. That's why we see so many people that are overweight and they're younger, even childhood and teen obesity, where you'll see the bigger middles, even in the males, because they have so much excess estrogen from being overweight. So keep your weight down, your diet good, your exercise up, as I always say, and then look into options to control your symptoms that your healthcare provider thinks are worth small risks for great benefits. With that, I want to talk about our main topic today, which is feelings, emotions, and moods. Emotions are driving me crazy. And I can't sing like a Bee Gee. I can't sing very well at all. But I can tell you that emotions can drive you crazy. And as they say, feelings, nothing more than feelings. Feelings are pretty powerful. So your feelings and your emotions and your moods you have to deal with. First of all, emotions and feelings and moods are not the same thing. And if you talk to your mental health provider, they can give you far more detail. I'm just brushing over the important stuff. But emotions are your physiological expression to certain things. And they can, they're triggered by chemical response, fight or flight syndromes, so to speak. They're based on data that goes in your brain of things you're seeing. If you're actually realistic in looking at things, and those feelings or emotions are things like sadness, happiness, fear, anger, disgust, and those things are what your feeling is at seeing something. If you see a terrible bloody accident or something, you'll either have disgust or sadness or those things. That's your brain processing into your emotions, and there'll be a chemical release of different neurotransmitters that make you have those emotions. But then they get expressed as feelings, and feelings can be a lot of other things. That's how you're interpreted. Feelings can be like an aggression or a resentment or vengefulness. And you got to be careful because those are biased. Those are things that your background, your culture, your upbringing, all those things come into play that can take that data that your body is trying to process in a healthy way, emotionally, into feelings that can be distorted and lead to the inability to change channels and dwelling on something until you become depressed. An example is if you lose your job, your emotion is going to be that you're going to have something like fear. Some of you may be sad, some of you may be happy, but you're going to have an emotion based on where you're at, and then that's going to turn into a set of feelings. You may have some resentment towards your employer or your supervisor, and then that may lead to depression, which is a mood and a behavior, and then you get into a longer term problem that will require trying to back up, sort those and parse those all out so you can process them in a healthy way and not an unhealthy way. If you've ever noticed, if you see somebody that has a kind of high-strung, anxious personality, they grew up around that. Behaviorally, they've seen that, so you'll model that just like your parent or parents or your siblings had that anxiousness. A lot of times you'll have that anxiousness. So you'll process your emotion, such as fear, in a different way than maybe I would, where it's a more laid back, easygoing, and rationalization, trying to be logical, saying, wait a minute, should I really fear this? I mean, you don't have to be scared to death of a honeybee, sitting on a flower. But now, if you've got a grizzly bear and a picnic basket and you're in the woods, that's something that your data needs to say you need to have a lot more fight or flight syndrome going on. And the fight's probably not good, and the flight's probably a really good idea. So you need to process those emotions properly. Very important. And why do I say that? From a medical perspective, not only emotional and mental and behavioral health, but you're going to get news primarily from your doctor, dentist, or healthcare provider that says this is good, this is not as good, or this is bad. And you have to process this in a way using information to subdue that fear and to logically look at your options and how you need to be treated. If you're ever very upset at a diagnosis, don't immediately let that fear sink in and become an issue. What you need to do is get a second opinion. Then you need to look at what you can look at health-based sites, health information sites, such as WebMD or Harvard Medical, or some of the good university clinics have great websites on health information. Look up your disease, understand what your healthcare provider is telling you, go to a specialist if it's serious, and get a second opinion if you have doubts or if it doesn't sound just right or it doesn't make sense to you. And then you need to make wise decisions and healthy choices. Most things are fairly curable. You will at some point expire, whether you're 50 or 100. At some point your body will break down. A lot of that has to do with the care you provided, the nutrition, the rest, the exercise, the diet. All that's going to work together, and then you're going to have a genetic component. But remember, genetics loads the gun, but the environment pulls the trigger. And you can control the environment. You can't control your genes much, but you can control your environment. So with that, I'd like to say, please go to my YouTube channel, Dr. Frank Says, My Doctor Says What? Or you can go to my podcast on all major platforms. Appreciate your viewing and your listening. Have a great day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.